What's interesting is that a bacterial infection spreading through the skin, whether it's the dermis or the epidermis, is actually impeded by how closely connected the cells are. So it actually slows down the spread of the bacteria that are causing the infection. Same thing if you have bacteria within an organ, within, say, your liver. The actual architecture of the liver, how close the cells are, and how closely they are connected to each other in the tissues of the liver will actually slow down the spread of the bacteria through those tissues. But there is a problem. The space between the tissues doesn't actually impede the spread of the microbes. Take, for instance, the disease we're talking here now, cellulitis. Cellulitis is a bacterial infection that is actually extremely fast spreading. This is a problem from a clinical standpoint because you may show up with a patient who has an area, say on their leg, on their thigh. It's a red, raised, slightly raised area that's warm to the touch. It's tender, it hurts. It's just a little bit bigger than the size of a ping pong ball, diameter-wise. Not like a ping pong ball there, but just that big. Give you that idea. That's warm. It hurts. They make a doctor's appointment for tomorrow. They show up the next day, and now the area is larger than the spread of their hand and their fingers. Get them into the hospital. The next day, it's now their entire thigh. What is happening here is that the layers of tissues, the dermal layer and the subcutaneous fat layer, and that layer, that's where the subcutaneous fat, a lot of the roots, the hair follicles, a lot of the arteries, veins, the circulatory systems, the main branches are winding through there. Well, it turns out that that layer between the fat, subcutaneous fat layer and all of that tissues, and just above it, the dermal layer. Turns out that these are very loosely connected. Okay, which is why you can go and say, like even on the back of your hand where the skin is thin, you can grab and you can pull up the skin and you leave the underlying subcutaneous layers there. We have thin layers of tissues separating the dermal layer and the subcutaneous layer. Well, it's that separation there, that area of separation between the two layers, since they are not interwoven together, that is where the bacteria thrive, in that in-between layer. They spread very quickly. Because you got to remember, this is an area that's still going to have, lots of nutrients floating by from the circulatory system. So the bacteria can spread very quickly. There's nothing impeding them. Now, there's going to be drainage, okay? Fluid delivered by the circulatory system is going to need to be drained by the lymphatic system. That's the whole point of the lymphatic system. Just draining fluid, and anything surrounding the cells, the tissues, will be drained here. Well, that's where these bacteria are. So some of them are going to be drained away with the fluid, and it's drained away towards the nearest lymph nodes. These bacteria will then drain to the lymph nodes, and they'll start overgrowing there. Yes, the lymph nodes house B cells, T cells, and some macrophages, but the sheer number of microbes getting there will be able to overwhelm the macrophages. The B cells, the T cells really can't do much antimicrobially because that's not their jobs. You end up with what is referred to as lymphangitis. Okay? You're actually going to get the spread of the infection, the spread of the inflammatory response. Anything that ends in itis, remember that means inflammation of. So you're going to get the inflammatory response spreading from the initial site of infection, following the pathway of the drainage to the nearest lymph nodes. You also could end up with what is referred to as bacteremia. Remember, bacteremia means you're going to get bacterial infection of the blood. Our two favorite gram-positive cocci are the main culprits here. Staphylococcus aureus, Streptococcus pyogenes. This is the two main causes for healthy individuals. If you happen to be an immunocompromised person, an immunocompromised patient, whatever is causing the immunocompromisation, it could be any bacteria, and it could be some fungi. This is an issue they see with patients that are bedridden due to advanced AIDS or high dose chemo/radiation treatments. Bedridden, bed sores get infected. The infected bed sores spread, causing cellulitis, drains to the nearest lymph nodes, and so on and so forth. If it's an infant, group B streptococci is the main culprit. Now, we didn't touch, and back in the bacteria chapter, we did not touch on streptococci in the different groups, group A, B, C. What they do is they take the different streptococci and they group them by abilities and virulence, pathogenicity. Turns out group B streps are the ones that, for all intents and purposes, are the worst of the worst. Diagnosis primarily is going to be through just clinical signs and symptoms. Red, hot, warm, really warm to the touch in given areas, and it seems to be spreading throughout an area, spreading towards an area you know is going to have a lot of lymph nodes, spreading on the thigh towards the inner groin, spreading on the arm to the armpit, spreading in the face to the jawline, the neck up to the jawline, because that's where the lymph nodes are. Treatment, if it's mild, is just going to be oral antibiotics. Things that have been shown to be still pretty good against Staph aureus and Streptococcus pyogenes, methicillin, amoxicillin. More involved, well, if it's spread, the patient has waited too long to go see their doctor or their nurse practitioner or their PA, well, then you're going to have to go into IV antibiotics. Okay, this is going to require hospitalization. If it's an immunocompromised patient, definitely hospitalization, high dose IV antibiotics. Why IV as opposed to oral? IV, you can get a higher concentration in and around the bloodstream faster than you can with oral antibiotics. You can also control and maintain a certain concentration in the bloodstream much, much easier with IV antibiotics over time than you can with a pill 3 times a day. One of the bad things with cellulitis, since you have that bacterial infection spreading between the subcutaneous layer and the epidermis, you can end up with damage to the dermal layer, death of the dermal cells in the dermal layer, spreads. Okay, you're going to get more once cells start to die, and not because of apoptosis, but because, bacterial infection, toxins, things like that. This triggers surrounding cells to also die. So you'll start to see the spreading of death through the dermal layer. Well, that's also then going to start to cause the epidermis to die off quicker and to be sloughed off. So you can end up needing surgical debridement, getting rid of damaged tissues. Get rid of the damaged tissues and the surrounding healthy tissues so that you can stop the spread of the bacterial infection.